Hi, everyone. This is Steve Dallasan, and welcome to this week's edition of CEOs You Should Know. I am excited that I am joined by Cristina Contreras, the CEO of NYC Health and Hospitals in Lincoln. Cristina, thanks for being with us today.
Thank you, Steve. Thank you for inviting me. It's a pleasure for me to be here.
We're excited to jump in to learn a little bit more about you and more about NYC Health and Hospitals in Lincoln. So let's get into it.
Okay.
To start off, why don't you tell us a little bit about your background and what initially drove you to have a career in the healthcare?
Interesting question. I was born in the Dominican Republic, and I came to this country when I was 15 years old. And going through high school, I had a lot of challenges, and I experienced some people that were very instrumental, very helpful. And there were people that kind of like wanted to make sure that the kids that were getting off track, trying to help them identify some of the problems and help them get through them. So I found that very helpful, and I said, you know what, I wanted to do something similar, and that's why became interested in becoming a social worker.
That's awesome.
Yeah.
And tell us a little bit about that. Your journey as a caseworker to CEO is remarkable, right? What were those like pivotal moments that helped influence that path?
Well, to be honest with you, I didn't really plan to become a CEO. It was never really in the forefront of my mind. But become a caseworker, I did everything under the sun in the healthcare field. It was very exciting to be able to help people individually. I did counseling, I did testings, I did outreach, I did marketing, I did everything, discharge planning. So helping people individually was exciting. However, when I started transitioning and learned that I could help improve processes, protocol, policies, it helped a broader scale of people. Instead of just helping one, I could help more. So I figured that that would be better, and it was more rewarding for me because
Yeah,
you're still helping people, but in a
100%.
different capacity. So I was able to explore that as an option, and it was better for me. And I started transitioning from caseworker, social worker to administration.
That's awesome.
Yeah.
I think the best CEOs are the ones that wore various hats all
You
throughout.
see,
So
you and I agree, Steve.
I
I love.
completely agree.
I finally somebody agree with me.
I'm sure over the last 3 decades, really
Yeah.
working in healthcare, as you mentioned, I'm sure there's a lot of really rewarding moments throughout your career. Are there any that stand out in particular?
There's many situations. I think the opportunities that I have given some of my, employees and also patients that you see the income, the impact directly. It makes a difference, right? I know in particular for instance, I have a couple of providers that they're doctors in the countries, and they come in and they're struggling obviously with the same things that I struggle with: the language, the transition, making sure that the documentation, the credentials are accepted in this country, and having the ability to at least open up opportunities for them. For instance, I have two particular doctors. That one is a resident currently at Lincoln Hospital. She's from the Dominican Republic, and one is also in the same situation from Honduras. And both of them had the opportunity to volunteer first, and then there was an opportunity, and they went into the residency program. That doesn't happen often, but it's good because you giving people opportunities. One, they're from the community.
Hmm.
Two, they also look and sound like the community that we serve. So
100%.
that gives them an opportunity in life, but also it gives our patient someone that is more reflective and representative of them. And there are people from the community, so they're going to become doctors and stay in the community. So that's it makes me feel really,
That's awesome.
it makes me feel
It's
great.
a win-win
Yeah,
and inspiring for the community, like you mentioned.
absolutely,
That's awesome.
absolutely.
So, as your role as CEO, what are some of your initial goals for the organization?
So that's interesting. For Lincoln, I've been a CEO for close to 4 years now, but at Lincoln, I just this is my fifth week. So it's kind of like,
Congrats.
I thank you. I just got here, but a part of my assessment, that my preliminary assessment, I want to make sure that Lincoln becomes the place that people want to go.
Mhm.
I want to make sure that Lincoln attracts good talent. I want to make sure my employees, they feel appreciated, value, um, heard, that they're part of the solutions, not
Mhm.
just part of the problem. That they help me do basically develop the strategic plan for Lincoln Hospital. Obviously, I want us to provide state of the art, a quality care which we do, but I want to make sure I always partner with different funding sources so I can ensure that we have the best technology, because the people from the Bronx deserve the best. And that I'm going to be partnered with anyone that I have to be partnered with to ensure that.
That sounds like a great vision.
Yeah,
You
thank you.
mentioned community earlier, right?
Yeah.
What role do you see community engagement playing in your leadership style?
Well, I'm a servant leader, and my background in social work, right? So I'm very much. You have different type of CEOs, but I happen to be a CEO that value and understand the importance of partnering with community organizations and community leaders and elected officials. Because at the end of the day, we all have the same goals, right? It's not just what happens inside the hospital. For me, being a CEO of a hospital, we have to make sure that when the patients come in, we provide optimal care, quality care, regardless of their ability to pay. However, I have to partner with community because I understand that the majority of my employees live in the community. I understand that my patients obviously are from the community. So if I can partner with people or organizations that help to improve the outcomes, I'm doing the best thing for my patients, because I'm trying to prevent them, take more ownership of their lives and their health, and prevent them from getting ill. I don't make a benefit for them to get sick and come as a last resort. I want them to choose to come to Lincoln to make us partners in the preventive care. But I want to partner with community. There's a lot of great work happening outside of the hospital walls. And I want us to be like a hospital without walls, where patients come in because they choose to. They want to partner with us to give education in the community to improve the outcomes. They want to hear from us what we're doing internally, but also I want to hear from them, what are they doing and how I can help.
Yep.
Yeah.
I think that's great. It gives you that, it shows them that you're supporting the community and gives them that trust in Lincoln.
Absolutely.
And gives you guys that credibility too.
Absolutely. That's a very good way to put it.
So I know for you, some of your top attributes as a CEO is you love authenticity, you love kindness, you love transparency. Those are all key pillars of your leadership style.
Who you been talking to?
How do you cultivate that into the culture of the organization?
So that's a very good question. I have a method, right? And I've been blessed that it always work. I like to I like transparency. So I want people to trust me, but you have to lead by example, right? Because
100%.
everybody can tell you, and other CEOs can come in and tell you, you have to trust me. You know, this is where I'm the CEO, and I don't start by saying that. I build trust by following through. I build trust by listening to my staff. I tell them, and they seen it, right? Because this is my 5th hospital in Health and Hospitals. I've been through several different hospitals, and people talk to each other. It's like a big family. So I can tell you one thing, but if I don't have the history of the legacy, people are not going to believe that. So I give them an opportunity. I want my leaders. I select the right leaders, right? So I have to have the right leaders that basically have the same model. I want the staff to feel value. I want the staff to feel heard. I go in and I don't tell them, patients are obviously first. You always hear that. But that's not my number one agenda. My number one agenda is to take care of the staff. To me, they're first. I take care of the staff, and the staff in turn take care of each other and the patients. So I built that because if I make them feel that they're important to me, that I value them, that I heard, that I can listen to their suggestions and recommendations, and even if I don't adapt all of them, they're part of the solution. They understand, listen, those are 5 great ideas that you have, but 2 of them I'm not going to be able to implement. And this one I might have to modify a little bit. These 2 are great. And I take it because I'm not an expert, Steve. My experts are the staff. They do the work. They know what they're doing. I make sure I have the right leaders. I make sure that people are skilled, they're effective, and that they take care of the staff. And that's how I build the trust and the transparency and the legacy. So it has been, working for me, and I continue with that model.
No, I think it's a great style. And it's a two-way street, right?
Yeah.
You're being transparent to them, and you're getting their trust, and I'm sure right back to you, they're being transparent to you. So I think that's an amazing style to have as a CEO.
Thank you. Appreciate that.
So tell me about an example or time that when you were focusing on your team's well-being that led to improved patient care or really a better outcome for the overall organization.
I can think of many different occasions. During COVID was very difficult times for everyone. But I know that it was difficult for the community. It was difficult for the staff. So we really built on the support for the staff, on encouragement, on the helping healers. We tried to make sure that the staff felt that we were there for them as well. It was overwhelming for everyone. And in healthcare, more than anywhere, obviously, because instead, it's like I always say with the cops and the firefighters, right? The fire comes and then we're running the other way and they're running towards the fire. And right, it's the same thing with healthcare. COVID, everybody was running away, staying home. We were encouraging them to stay isolated and protected. Meanwhile, we have to come to the hospital to make sure that we took care. But we really put a lot of things in place to support them.
Mm-hmm.
There was a lot of communication. There was a lot of group support system. We also tried to create built on the and I have to be honest with you, social media was not my thing, and it's still not my thing. Don't tell anybody. But I use social media to communicate with the community because I know people were saturated with a lot of information. And we can give information. We had doctors talking to people to answer the questions that they're not hearing.
Yeah.
Right? Because we heard there was a lot of information.
100%.
But there was things that people have questions that nobody was answering.
Yeah.
And we created an outlet for the staff and for the patients. So I think that was I guess one good thing that we did that helped improve the outcomes.
Yeah, it kind of follows that suit of really over communicating to the community and having that credibility and that trust during that time.
Mm-hmm.
There was a lot of uncertainty, so it's refreshing to hear that you guys were leading that charge.
Oh yeah, no, absolutely.
I know we just talked about all the great emphasis on the community, and part of that obviously is the underserved community.
Oh, yeah.
What specific initiatives have you implemented to really improve their access to care for that population?
There's so many, Steve, but one of the things that, and again, it keeps like coming back, and I have to say, like you said earlier, I think being a social worker makes me the best CEO. I know that there's all kinds of CEOs, there's CFOs, they come from nursing, they come from all different professions. But I think the component that makes me a stronger person is because I connect with people and I understand the importance of certain things, right? So the fact that we can, like patients that come in, they have issues with access because of the education sometimes. They don't understand how to navigate the healthcare system. So you need to understand how to tap into that so you can be instrumental and really effective to help them. So not only in the hospital, I work with the doctors to understand that we have to create templates, that we have to create access. When I lose providers or nursing, I always talk to the team to make sure they bring in bilinguals. So it's kind of like an opportunity, right?
Yep.
You're always keeping that in mind. So on one hand, I'm improving access internally and leveraging what we have in terms of the templates, opening access to a night shift, Saturdays, being realistic that the community is working. We deal with the majority of our community, for instance, could be challenged. They don't have healthcare protection. They don't really have a job that we're blessed to, that if I have to go to the doctor, so I can afford to make an appointment and I still get paid.
Yep.
Some people have to take one day to go to the hospital, and they can even lose their jobs.
Fair, yeah.
They lose their jobs. They basically
Lose their
they don't
pay.
get paid. And the majority of the people, and I'm talking about a lot of different things, but the majority of the people don't have that luxury. So when you're making decisions about creating access, you have to keep that in mind. So you got to be realistic. It's not what works for me. It's not what's convenient for me, creating access. Oh, yeah, we have evening shift, but the last patient is at 4 o'clock. How is that helping anyone that works until 5 o'clock? So it's creating the access internally. It's also understanding the challenges. Let's be real. There's a lot of issues with chronic diseases, right? But how can I tell a patient in the community, listen, you got to come for your appointments once a week, okay? Because this is what's important to you. When the person is dealing with housing issues, the patient is it's patient for us, but community person, they're struggling with challenges of being evicted. Maybe they're going through a divorce. Maybe their child is doing horrible in school. They have concrete problems. Yeah. And if you cannot tap into that, if you're not sensitive enough to know that we have to deal holistically with what they're challenged with, you're really not going to make a difference. Because I can increase access, but do they know about it?
Yep.
Do they know how to navigate? Do they know how to escalate certain things? You got to give them the tools for that. For instance, Lincoln in particular, we have, I don't know if you're aware, but Lincoln emergency room was one of the third busiest emergency room in the nation.
Wow.
We have a lot of patients. We could see between 140 to 160,000 patients a year. And that's very impressive. However, we also learned through the data that a lot of those patients, of course, there's a trauma center, level 1 trauma. We have a lot of traumas. We see a lot of patients that need to be seen. But a lot of the patients come in to the emergency room as a primary care. Is it because we make it too difficult to come into the clinics? Is it because they don't really know that, just because you have a headache, you're waiting until the last minute? Or is it because they're going to lose their jobs? And you know what? I go at nighttime after work. I can't deal with this pain. Let me go at nighttime when it's convenient. I don't know. I don't have all the answers, but I can make some assumptions.
Yeah.
Based on the data that I see in the community.
No, it's refreshing to see that you're seeing a problem and you guys are actively working to fix it. So I think that's great for anyone tuning in that's part of that community, the work that you guys are doing there.
Thank you.
I know one of the recognitions that you get a lot is for advocating for minority women. What specific initiatives have you championed to support this demographic?
There's so many. We don't have 3 hours, right? No, but I can think of a couple that have to do with healthcare. I take pride in saying that, obviously some of the challenges, one of the reasons I like to highlight the fact that I'm a CEO is because there's not a lot of people that look like me in positions like this. The reality is, even growing up, I never saw anybody that I could relate to as a CEO. I didn't even know what a CEO was. And I still don't know. No, but joking aside, I like people like women, especially minority women, Black women, Hispanic women, Latino women, Dominican women, to see that there's an opportunity, that if there's something they want, they can obviously get there. But I have to create the spaces, right? Because it's easier for us to say, oh, yeah, you should become a CEO. Yeah, how do I do that? Where do I go? So I try to work with community organizations that help women or help the youth in some training and create easier access, streamlined processes for them to be considered for entry-level jobs. I also create we don't have really a defined program right now, but it's pay internship. You do internship when you need to do internship. You do, obviously, because of educational requirements. You do a lot of different things. But the reality is, I don't know a lot of people like me, but when I was in college, obviously I was struggling being a full-time mom, full-time student. I had 2 jobs. I didn't even know if I was working, 7 days a week. So sometimes I was leaving my house. I didn't remember if I was going to school or going to work. And that's my reality. And I'm sure a lot of people can relate to that. So if that was my reality, if I can add something like a pay internship to give them an opportunity to get into the system, it's a win-win, Steve, because I get someone, a minority woman, coming into the system, getting a pay internship so she can actually afford to be there and learn more about healthcare, maybe choose one of the disciplines that I have. Not everybody has to be a doctor or nurse. We have accountants, we have lawyers, we have everything inside the hospital, drivers, we have all different types of professions. So I always try to create the space where women can have opportunities, everyone overall, but I always try to highlight women because we don't get a lot of chances. And also, I partner with local schools like Hostos Community College, Lehman College, different organizations. We had a very important program back at Metropolitan that I want to adapt here. We're probably not going to call it the same, obviously, but it's an opportunity for young people from high school to come into healthcare. And for 5 weeks, they not only shadow the leaders, they also have an opportunity to be part of the experience, right? So they see the people, the phlebotomists, they see the lab techs, they see the radiologists, they work with anesthesiologists. They see what a doctor for OBGYN, what is that? Because conceptually you can talk about it, but if they see it, they can really see, okay, this is something I want. And I'm selfish, so I kind of integrated a part of the administrative for them to have a shadow opportunity to talk to me because I want them to consider becoming a CEO. Hey, I'm important too. So I want to make sure that I create those spaces. And finally, just some of the things that I do. I also work with community organizations to create mentorship programs. I like to mentor people. People are they always gravitate towards me. I don't know why, but they wanted me to mentor them, and I do that, especially when it's women and minority women. I make an effort because I think it's important. They might
Yeah.
not know what they want to do in life, but at least they discuss options and opportunities.
Yeah, I think that first of all, I think that's amazing and definitely inspiring. I think that it's awesome that you integrate yourself into it because what an inspiring journey, obviously coming from the Dominican Republic, having
Yeah.
all the various roles and now being CEO. So I think that's really important. But the other key takeaway for me is you're giving them that opportunity, right? They're getting that foot in the door into the healthcare.
Yeah.
And then from there, they could see what opportunity they want to take next. So
And I can hire them.
that's awesome. It's a remarkable program you should be
Thank
proud
you.
of.
Thank you. Thank
So
you.
let's talk a little bit about your vision, right? I know that you said you're 5 weeks into the role.
Yeah.
What is your vision next? What do you see next for NYC Health and Hospital Lincoln?
So, it's very interesting because when I first came, I did a town hall meeting introducing myself, and everybody always asks questions, right? I'm not the type of CEO that's going to come and dictate.
Mhm.
Remember, I'm kind of like collaborative, servant leader. So I came in, and the first thing I did was trying to engage the clinical leaders. Most of the times, I don't know if everybody understands the dynamic of the hospitals, but the clinical leaders, they do an amazing job. But, it's unfortunately in some instances, it's like a silo, right? They're working in
Mhm.
this direction, and the CEO and administrative team is working in that direction. For me, I want to bring everyone together. And we're working right now on developing what that strategy looks like for the hospital together. I don't want to come in and say, Lincoln Hospital, this is what you need to do, or this is what I think you need to do. I want to come up with the decision or the definition what the strategy should be for us, where we need to focus our efforts, what we need to do, how do we want to bring Lincoln to the next phase. Obviously, they do. I have amazing staff. I have an amazing team. So I'm very proud of that. But I want to work collectively with them to see what that looks like for the future and what my role is going to be in all that. But right now, definitely, one of the main thing I want to do is increase the morale. I want to make sure that Lincoln people feel excited to come to work, that they love working at Lincoln Hospital, and I want to attract good talent, that people understand the value, how iconic Lincoln Hospital is. I'm learning the beautiful history that it has, but how iconic and instrumental for the community it is. I have close to 5,000 employees, which is impressive.
Mhm.
And like I said before, Steve, a lot of those people work in the community. So there's no way that I can come in and develop a strategy that has nothing to do with the community. There's
Yeah.
no way. Otherwise, I'm not going to be successful. So whatever the strategy we're developing right now, I want Lincoln to be number one. I want people to choose us because they want to come to Lincoln and they have confidence in the care that we provide. I want to attract great talent. I want great people to work there. I already have good people, but I'm putting together part of a new CEO. You do assessment and you have to restructure. I'm restructuring to have the best team possible that aligns with my vision and this my strategy to work with the staff to support them. So that's kind of like, in a nutshell, kind of like the framework of how I'm working on the strategy. And anything that can help me provide excellent care, quality care, state of the art equipment, state of the art, making sure that that facility feels welcoming. That's part of my strategy.
That's awesome. It follows to what we talked about earlier, all about that collaboration and getting the feedback from your team, from the South Bronx community to be able to make that vision come to life. I'm very confident from our time together, you're going to help boost the morale there.
Thank you, Steve.
I think
I
that's
need that.
I think
I need
that's a
that.
no-brainer.
I need that support.
So speaking of the community, how do you plan to collaborate with other district leaders and community organizations to help implement solutions to some of the problems in the South Bronx?
Oh my God, that's a great question, Steve. Did I tell you to ask me that? Let me tell you, the first thing I did, I told you it was 5 weeks, right? But I already started, and that's why I'm always a little busy, right? Because I do a lot of internal assessment, internal work, internal support, internal rounds, internal. But I also do external. So I already reach out to a lot of the community organizations. I'm already setting up meetings with elected officials. I met with some of them already, discussing my agenda and making sure that it collaborates basically with their agenda. See how we can partner. I have community entities that are doing great work, historic work. They're doing amazing work at Mary Mitchell's, the Mothers on the Move, the Community Board 1, Community Board 2. We already established conversations and many more. Because, again, I need to find out how I can kind of be instrumental and what is my role as a Lincoln Hospital, as an entity? What is our role in helping their agenda? Because if their agenda means well, and I'm going to be honest with you, Steve, it has to be something that means something for the community.
Mhm.
I'm not going to partner with anyone that has no real intentions of making a difference. You have to want to make a difference, and you
Mhm.
have to have a track record. I want to make sure that transparency is there, and everybody claims to do good work, and that by all means keep doing that. But if I know that you're doing something great, I want to be part of that.
Yeah.
I want to be part of that, and we're discussing right now ways in which we can make a difference. And it could be partnering with maybe bringing education, something to the schools, for us to give education on a regular basis. It could be the doctors going out there more. It could be screening. It could be them coming to, using the hospital more for
Mhm.
education, for counseling. Maybe they're doing like the precinct want to do the council meetings. No problem.
Mhm.
Welcome to Lincoln. It could be us maybe developing some curriculum for education for programs. Like we have an amazing program right now under Guns Down Life Up, which is like after school program. We have the kids. At the end of the day, we have to make sure that the kids have options,
Mhm.
because everybody talks about the crimes and what's happening and being victims, right? But at the end of the day, what are we doing to
Mhm.
add to the solution? Are
And to
we
prevent it. Yeah.
creating spaces for them to go to? So right now, this program is amazing because they bring them to the hospital, and I'm actually looking for partners in that, right? Because it's a great opportunity for them to get education in sports, right? For them to do dancing, anything that's productive that
Mhm.
keeps their minds off getting into gangs or getting into trouble, right? I wish I had those options. Thank God I didn't get in trouble, but it could have been different, easier for me. But giving them an opportunity. So that's how I've been partnering with community organizations, elected officials, community leaders. They're really been embracing me, and I'm very thankful for everyone because they treating me really like I'm the answer to their prayers, and I really don't want to disappoint
That's awesome.
anyone. So
No, that's definitely inspiring. It's the future of the community that you're
yeah.
you're impacting and you're helping. I know there's been recent funding for the Bronx Recovery Center. How do you envision that facility really helping impact the opioid crisis of the community?
Oh, it's a very important program, and I think the fact that we can bring it from, because right now it's in one of the offsites.
Hmm.
If we can bring it, that's the funding is for, to restructure the department, build it internally, so we can offer the patients in the community the services there, so they don't have to go to Belvis. They can come straight to Lincoln Hospital and receive the services that they deserve in the hospital that they belong.
That's awesome. I'm sure that there may also be some challenges coming up, right? What are some of those strategic challenges you're anticipating for the healthcare landscape?
In general, again, I wished more minority people would go into healthcare, especially leadership positions. And just because, again, diversity matters,
Hmm.
representation does matter. Being a social worker helped me, my perspective, because I feel that, again, it's just me talking about me, right? But I feel that it makes me a better leader because I understand
Hmm.
the struggles, and I've been there and done that. So it's not like somebody's telling you, oh, it's a conceptual or something you're learning in the books. I've been through those rough situations. I've been through the struggles. I had my fair share. So I think that more people should really be considered, but it's kind of scary sometimes. So that's why we need to make an effort, us in leadership position, and to bring people into the spaces and teach them, and then not make it so scary,
Yeah.
right? Because at the end
Yeah.
of the day, it's not scary. But sometimes when you don't know what does the CFO means, what does that mean? It's not just count. It's not something conceptually that a CFO. Maybe if you're good in math and you're good in accounting and you get your degree, you can become a CFO, and it's just guiding all the finances efforts. And so it's always, I think, encouraging more minorities to get into leadership positions and to get into healthcare,
Love that.
because everybody, is scared to get into hospital settings, but it's not scary. And you don't have to just be a doctor or a nurse. You could, and that's amazing, and we support you. But this entire operations team that support the day-to-day operations of a hospital, and I want more people to get into that.
That's a really good fact because a lot of people probably, as soon as they hear healthcare, they immediately probably go to a doctor or nurses. But to your point, there's so many other roles within the industry that are available.
And the finances is always a challenge, right?
Mhm.
Things are changing, and we need to be more proactive and more involved in preventive care, versus because the hospital structure over the years has changed. We're not encouraging people to stay in the hospital. We really want them out there to stay healthy. So everything is kind of like changing. It's a transforming in a good way.
Yeah. Well, looking ahead, you have a great vision for the future. But I'm sure there's a lot of immediate needs also stepping into the CEO role. How do you balance those two? How do you balance the immediate needs of the hospital, but also the future vision that you have?
I do. I honestly, and this is very simple for me. I don't. I want to believe, Steve, that I'm balancing. I try my best because I feel that what I do is not for me. I really mean that. I think that I represent a lot of people, and
Hmm.
I don't want to disappoint anyone. I think that I represent not only the women, the minority women, Dominican women, everyone out there that we telling them to get into that space and become a CEO. So I'm here now, and I don't want them to feel that, oh my God, she's doing a horrible job. And of course, we're never going to get opportunities. So I feel that I'm balancing, but it takes a toll. It takes a toll because I have to sacrifice sometimes. Most of the times I have four kids. They're not kids anymore, but my youngest is 11 going into 12, and I think she thinks she's 20. But I have four kids, right? And they know I always become. They have to be part of what I'm doing. I do a lot of community work.
Hmm.
I do a lot of what they call volunteer work sometimes, and I always used to take them with me so they can see how come their mom sometimes is missing some of their performances, or sometimes why mom is not always there. And I'll tell you a quick joke before. My daughter once, she was too smart for me. She's the one that kept me my schedule for the personal. Anything personal, she had to keep my schedule. And she told me, Mom, you have to go to parent-teacher conference. I said, oh my God, no, I don't have time. I have a meeting, blah, blah. She said, no, I already spoke to your secretary and I booked it. So, she was smart enough to know, if you talk to me, I probably don't make the time. But if you talk to my secretary, it will happen. So she booked herself, and I had to go to the parent teacher conference, but
That's
but it
awesome.
was funny,
Yeah.
but that's the life of a CEO sometimes. You have to you have to represent.
Yep.
So sometimes my presence is important in different spaces. Not because I don't have anything better to do, but it's because I have a voice, right?
Hmm.
And now I'm talking for 5,000 people, and I need to make sure that I'm in the spaces so I can represent what they need and what they want.
Yeah. Well, I'm sure just as you're an inspiration to many that are looking to aspire to CEO, I'm sure to your kids, they're very proud of you and
Oh, yeah.
inspired by the work
They
you're
think
doing.
they're my CEOs. They're my bosses. They're telling me
Don't
what
they
to do.
all, right?
I know.
Oh, man.
Oh my God. They didn't get the memo.
As healthcare continues to evolve, what advice would you offer to other organizations within the space to respond to new challenges?
I'm going to tell you something that I always tell my staff and my team and people that are trying to be in leadership position. And, something that was scary for me before that I have been able to overcome. You don't necessarily have to have all the answers. So even though things are changing, doesn't mean that we have to know everything right now. But be open and receptive to things and always think fairly. And I think we're never going to make a mistake. We're always going to do the right thing. You're always going to be representative of everyone. You're always going to be, I guess, followed, respected, well regarded if you do things fairly and if you do it for the right reasons.
Hmm.
So even though there's a lot of things changing, transforming, I think if you have the right team with you and the right, you always be transparent and embrace them. They're always going to be there for you, and we can overcome anything that comes through.
That's awesome. We covered a lot, right?
Yeah.
But looking ahead, are there any key goals or initiatives that we might have missed that you want the listeners to know about?
No, I really want to emphasize that in healthcare, especially health and hospitals, we have a great mission. So we take care of everyone regardless of the ability to pay. And that's important regardless of their immigration status. That's a great mission. You have to be mission driven to be there because not a lot of people, we're not there for the money. We don't make the money. It's not, that's not the reason. So I want people to realize that there's a lot of challenges financially. So in the future, I'm always part of being a CEO is trying to get those opportunities, trying to consider different funding sources, trying to advocate, trying to have in those conversations. And that's part of my role. It's not just internally trying to make sure we provide high quality care, provide good outcomes, and that we're doing the right thing when patients come to us, but also be instrumental in the community.
Hmm.
But I want to make sure I'm responsible enough to get the right funding for the hospital so we can continue to thrive
Hmm.
and survive and thrive, and that's part of my responsibility. So if you know any funding sources out there, please, by all means.
If anyone wants to reach out to you, right?
Yeah.
Or if anyone wants to learn more about NYC Health and Hospitals Lincoln, what is the first step for them to do?
Oh, definitely go to our website and don't kill me, but I'm gonna make sure that the website is
Go for it.
nychealthandhospitals.org. And you have not only the 11 hospitals, but everything that we do, all the businesses under the hospital industry. But you're welcome to get more information about everything, individual hospitals. But go to Lincoln because I'm here representing Lincoln Hospitals, and we do great work.
That's awesome. Christina, it was an absolute pleasure having you. I am definitely very inspired by having you on the show. I'm so excited to see what you're going to do next. But I'm sure everybody tuning in that heard your journey, thank you so much for sharing with us.
Thank
And we
you.
appreciate all that you do for the community.
Thank you so much, Steve. Thank you for having me. It's a pleasure for me to be here in iHeart Media. Thank you.
Congrats, Christina. And
Thank
thank you
you.
to everybody that tuned in. Please tune in next week for next week's edition of CEOs You Should Know.